HIV continues to pose a significant public health concern in many urban areas in the Philippines, including Iloilo City. As rates of infection rise among adolescents and young adults, there is an urgent need for effective evidence-based interventions that address both knowledge gaps and risky behaviors. Comprehensive sex education has emerged as one of the most reliable strategies for reducing vulnerability to HIV, as it provides individuals with the information and skills necessary to make informed decisions about their sexual health. Thus, comprehensive sex education in Iloilo City plays a crucial role in preventing HIV by equipping young people with accurate knowledge, promoting responsible sexual behaviors, and empowering communities to challenge stigma and access essential health services.
The statistics on HIV in Iloilo City illustrate both the scale of the issue and the lived realities behind these numbers. Since 1986, a total of 1,646 cases have been documented, reflecting nearly 40 years of individuals and families affected by the condition. This long-term figure underscores that HIV has remained a consistent public health concern in the city, requiring ongoing attention and responsive interventions. In 2024, the city recorded 237 new cases, with 10 of these reported in December. This steady occurrence of new infections throughout the year suggests that transmission continues to take place across various communities. Each monthly figure represents not just a numerical increase, but a person who has received life-changing news and now must navigate the challenges of treatment, stigma, and adjustment. The trend persisted into 2025. From January to June, 48 new cases were identified. Although this reflects only the first half of the year, it indicates that new infections continue to emerge, reinforcing the need for sustained prevention efforts and improved access to testing and counseling service.
Introduction. Human immunodeficiency virus, HIV, continues to pose a significant public health concern in many urban areas of the Philippines, including Iloilo City. As rates of infection rise among adolescents and young adults, there is an urgent need for effective evidence-based interventions that address both knowledge gaps and risky behaviors. Comprehensive sex education has emerged as one of the most reliable strategies for reducing vulnerability to HIV, and as it provides individuals with the information and skills necessary to make informed decisions about their sexual health. Thus, comprehensive sex education in Iloilo City plays a crucial role in preventing HIV by equipping young people with accurate knowledge, promoting responsible sexual behaviors, and empowering communities to challenge stigma and access essential health services. Basic understanding of HIV. Ah, So the first that we are going to talk about is the basic understanding of HIV. So a fundamental steps in preventing HIV is ensuring that the public understands what HIV is. Through sex education, individuals learn. So what is HIV? It is a virus that weakens the immune system by targeting specific white blood cells. The difference between HIV and AIDS is HIV is the virus, while the AIDS is the advanced stage of infection that develops without treatment. The reality of modern treatment with antiretroviral therapy or ART, people living with HIV can lead long, healthy lives. This foundational knowledge demystifies the virus, dispels long-standing misconceptions, and empowers individuals to approach the issue with clarity and confidence. When the community understands the science behind HIV, they are more likely to make informed decisions that reduce their risk of infection. Modes of transmission. Now, we are going to talk about the modes of transmission of the HIV. Comprehensive sexual education provides accurate, evidence based explanations of how HIV is and is not transmitted. The following is how HIV is transmitted. First is unprotected sexual intercourse with an HIV positive person, sharing needles or syringe, transmission from mother to child during pregnancy, childbirth, or breastfeeding. The last one is exposure to infected blood through certain medical accident And the last one is exposure to infected blood through certain medical or accidental situation. And the following is how is HIV not transmitted? So the first one is kissing, hugging, or casual contact. The next one is sharing food, utensils, or drinking glasses. And the last one is mosquito bites or environmental exposure. Clarifying misconception is essential. When individuals understand the real pathway of transmission, they can take realistic precautions without unnecessary fear. In Iloilo City, where stigma and misinformation persist, educating residents about the true modes of transmission is a powerful tool for protection and awareness.
Risk reduction prevention. Sex education equips individuals with practical tools and strategies to reduce the risk of acquiring HIV. These strategies include safe sexual practices, correct and consistent use of condoms, limiting the number of sexual partners, engaging in mutually monogamous relationship with partners who have been tested, access to testing and early detection, encouraging voluntary HIV testing as a regular part of healthcare, promoting awareness of available testing centers and community health facilities in Iloilo City, highlighting the importance of early diagnosis in preventing further transmission, awareness of medical prevention tools, introducing pre-exposure prophylaxis for individuals at higher risk, promoting the importance of antiretroviral therapy for those living with HIV to achieve viral suppression, reducing the likelihood of onward transmission. By teaching these preventive strategies, sex education transforms information into action, giving individuals the ability to protect themselves and contribute to lowering the number of new HIV cases in the city. When communities in Iloilo City understand the realities of HIV, they will become more supportive and compassionate. Reducing stigma allows more people to come forward for testing and treatment, which ultimately lowers transmission rates. Combating stigma and discrimination. HIV prevention is not solely a medical issue, it is also a social one. Stigma and discrimination discourage people from seeking testing, treatment, and accurate information. Sex education plays a critical role in changing these harmful attitudes by number 1, presenting HIV as a health condition, not a moral failing. Number 2, teaching empathy, inclusiveness, and respect for people living with HIV. Number 3, encouraging open dialogue about sexual health to reduce shame and silence. And lastly, showing how stigma contributes to the spread of HIV by isolating individuals who need help.
The fight against in Iloilo City is far from over. Every new case is more than a number. It's a life, a family, and a community affected. These realities remind us that prevention is not just a health issue, but a shared responsibility. Sex education remains one of our strongest tools. It empowers people with knowledge, practical skills, and the confidence to inform choices. But awareness must lead to action. To the youth, stay informed, practice self behaviors, get tested when needed, and encourage open, honest conversations about sexual health. To parents, educators, and community leaders, support comprehensive sex education and complete safe spaces where young people can learn without judgment. To policy makers, health authorities, strengthen access to testing, treatment, and prevention programs, and ensure the services reach every barangay and vulnerable group. Ending HIV requires all of us small actions and conversations. A test, a gesture of support can make a big difference. Together, we can fight stigma, stop the spread, and build a healthier, more compassionate Iloilo City. Let us remember, HIV is preventable, compassion matters, and knowledge can save life. The time to act is now. Iloilo City has the people, the programs, the potential to change the trajectory of the fight. By working together, we can turn HIV from a silent threat into a challenge we face with courage, understanding, and commitment. Take action today. Learn the facts, support others, speak openly, seek care, and believe in change. When a community stands united, every life matters, and every case prevented is a collective victory.